So when you get your fluids, sometimes you'll have to set them up at home. So you'll have the fluid bag, the fluid line, and then they'll send you home with however many needles you need. So I'll just show how to set it up first. So all of the fluid bags should be in their little package. So just want to open that up and take your fluid bag out. And then there's a little perforation up the top on here. So this top just kind of tears off, and take your line out. So you want to keep it as clean as possible. You don't necessarily have to wear gloves or anything like that, but just keeping it as clean as possible. All right, so the area that we're going to put the fluid line in is this area here. So you're just going to remove the little plastic top. And you're going to see the little entranceway there. We're going to take our fluid line out of our bag here. And then this we call spiking the bag. So you're just going to take the top part off of this. And it has not really a needle, but kind of a sharp piece of plastic, and that's what you're going to use to get into the fluid bag. So you're just going to take this, put it right into the little area that we just opened up. Sometimes it takes a little bit of wiggling to get it in. We want it to be nice and tight, so make sure it's all the way down. And then we're just going to run the fluid through the line to make sure that it's all primed. So we're going to lift up the bag, and we're going to have to run it all the way down the fluid line so you can see it running down in the little chamber. Once it makes it all the way through the line, there's two options. So the easiest way is the little blue clamp. So with this one, you can see that it's on. The line is through the opening. And to shut the line off, we're just going to slide it through so that it's clamped right there. So you can see that the fluid isn't flowing there anymore. That one's probably the easiest one to use. There's also the roller clamp, which is this one here. So right now you can move it up and down the line. It's not clamped on anything. And to clamp it, you're just going to take this little roller part here and just roll it down. So as you're rolling it, you can feel it kind of tightening up on the fluid line. And you're just going to roll until it's down the bottom. Now we can't move the roller clamp, and the fluid is not flowing anymore. So when you want to put your needle on a new bag that you just got, it'll have this little plastic protector on the top. So you're just going to remove that, and that's the part where you actually attach your needle. So with your needle, it comes with the little plastic piece on the bottom. Just give it a twist and that'll pop off. And then this part is where you're going to attach right here. So just put it on, and then you can twist this up so that it's not going to come off. And then when you're ready to administer your fluids, you're going to have your pet wherever they're comfortable, so either on a couch, on the floor, wherever they're comfortable. The easiest place to give fluids is right in kind of the scruff area, so right behind the shoulder blades. They have a lot more skin, they can hold fluids there, it's a little bit more comfortable for them to give. So we're just going to make sure that we have our needle ready. We're going to pick up the skin here, so you make a little tent area right where we're going to put the needle, and then we're going to put the needle right in there. And then wherever we clamped it off, we want to make sure that we unclamp it. You want to have your fluid bag higher than the patient so the gravity will help it flow. And then you can see that the fluid is running right in the little chamber area. And that's where you're going to make sure that it's continuing to run. If that stops without you clamping it, or if it slows down, you might need to adjust either your needle area where it's in the patient, or how high you're holding it up.